My name is Surgeon Dr. M. Glani, and I'm a part of team of doctors who are going to treat you. So tell me about your name and your age.
My name is Mr. Shakil. I am 22 years old.
Okay. So here I am going to examine your legs for the varicose veins. During the examination purpose, I will not hurt you. And during any part of examination, if pain occurs, you can inform me.
Okay, sir, you are loud.
Now kindly stand up and put your trouser up. Well, now we are proceeding towards the inspection part of the examination of our varicose veins. They are better inspected in the standing position. First of all, we will go at the back of the patient, we will inspect. After that, we will come in the front of the patient, we will inspect. Now we are going to the back of the patient, we are inspecting. Look for the course of the veins, either it is short saphenous or the long saphenous. Inspect for the visible varicosities, pigmentation, scar marks, size of the legs, and the extent of the varicosities. You will see either one leg is involved or both the legs are involved. And the inspection should be in the better light, so your examination findings, they are going to be perfect. Well, now we are going to the palpation part of our examination of the varicose veins. So first of all, I am going to palpate on the upper leg on both the sides with my both the hands, and after that I am going to palpate the other leg for the varicose veins. And remember, this step should be very gentle. First of all, you will do from the front, after that you will do from the back, same process. Mr. Shakil, kindly lay down on this bed.
Okay, sir.
So when the patient lays down, come to the leg side of the bed and put the leg of the patient and take it on your shoulder. After that, squeeze the veins, empty the veins, and after the veins has been emptied, apply the tourniquet above the knee as high as possible. And now ask the patient to stand up after that. Now Mr. Shakil, can you stand up for me?
Okay, sir. I am standing.
And now look, either the veins are being disappeared or they are being more prominent. After that, remove the tourniquet and see the effect. And repeat this procedure on the other leg also. So suppose if after squeezing the veins, emptying the veins, applying the tourniquet, and when we ask the patient to stand up, if veins don't appear and on removing the tourniquet they appears, it means that was the defect was the higher than the tourniquet we have applied. On the other hand, if there is no effect of applying the tourniquet and the veins fill up while standing up, still we have applied the tourniquet, it means the problem is not higher up, it's below the tourniquet which we have applied. In case of modified PERTHES test, you will ask the patient to stand up and let the veins fill to the maximum. After that, apply the tourniquet as higher as possible. And then after that, give the command to the patient to walk. Now Mr. Shakil, kindly walk from this end to the other end and keep on walking.
Okay, sir. I am walking now.
That's good. Mr. Shakil, keep on going. While the patient is walking, due to the effect of the gastrocnemius and the soleus muscle, blood should come back from the superficial veins to the deep veins by the pumping action, and at least some of the varicosities, they should disappear. If the varicosities, they don't disappear after the walking, become more prominent, it means perforator incompetence is there and some blood is coming from the deep veins to the superficial veins. So this is the interpretation of this test. And finally remove the tourniquet. Remember, you will repeat all the tests on the other leg also. Due to shortage of time, I am not doing the test on the other leg. So while in examination, you will do on the other leg also. Well, now I am going to perform the Feegan test to mark the perforators. First of all, Ask the patient to stand up and let the veins fill up to the maximum. And after that, take the marker and mark the varicose veins. Like this, I am going to mark with the help of the marker. Exactly this. The other leg also. So after that, ask the patient to lay down on the bed. Mr. Shkil, lay down on bed.
Okay, sir. I am laying down on the bed.
That's good, Mr. Shkil. Now come to the leg side of the bed, and after that, cameraman kindly go ahead in the front and show this. Now again, you will elevate the leg. After that, you will allow the veins to empty maximally, and you will palpate along the medial malleolus and along the posterior border of the tibia. Remember, at this point I am not palpating the veins, I am palpating the posterior border of the tibia, and I am finding the dip here and mark that dip there. That's the perforator. Again, continue this procedure, and again I am finding the dip, then I will mark that dip. And you will repeat this procedure on the other side. So cameraman, kindly move your camera to the other side and show that leg. Finally, I am doing the same procedure. First of all, let the veins to collapse, and after that start from the medial malleolus and continue over the posterior border of the tibia, and where do you find the dip, you will mark it, and we are finding the one dip here, and that's the perforator. Finally, our Feegan test has been complete, and at the end you will cover the patient, and finally you will say thanks to the patient. So finally, thank you, Mr. Shakil.
You are most welcome, sir.
And that's the end of our procedure.